Coffee is a brewed drink prepared from roasted coffee beans, the seeds of berries from certain coffee species. The genus coffee is native to tropical Africa, specifically having its origin in Ethiopia and Sudan, and Madagascar, the Comoros, Mauritius, and Réunion in the Indian Ocean. Coffee plants are now cultivated in over 70 countries, primarily in the equatorial regions of the Americas, Southeast Asia, Indian subcontinent, and Africa. The two most commonly grown are C. arabica and C. robusta. Once ripe, coffee berries are picked, processed, and dried. Dried coffee seeds, referred to as beans, are roasted to varying degrees, depending on the desired flavor. Roasted beans are ground and then brewed with near boiling water to produce the beverage known as coffee. Coffee is darkly colored, bitter, slightly acidic and has a stimulating effect in humans, primarily due to its caffeine content. It is one of the most popular drinks in the world, and it can be prepared and presented in a variety of ways, e.g., espresso, French press, café latte. It is usually served hot, although iced coffee is a popular alternative. A 2017 review of clinical trials found that drinking coffee is generally safe within usual levels of intake and is more likely to improve health outcomes than to cause harm at doses of 3 or 4 cups of coffee daily. Exceptions include possible increased risk in women having bone fractures, and a possible increased risk in pregnant women of fetal loss or decreased birth weight. Results were complicated by poor study quality, and differences in age, gender, health status, and serving size. Digestion. A 1999 review found that coffee does not cause indigestion, but may promote gastrointestinal reflux. 2 reviews of clinical studies on people recovering from abdominal, colorectal, and gynecological surgery found that coffee consumption was safe and effective for enhancing postoperative gastrointestinal function. Mortality. In 2012, the National Institutes of Health AARP Diet and Health Study analyzed the relationship between coffee drinking and mortality. They found that higher coffee consumption was associated with lower risk of death, and that those who drank any coffee lived longer than those who did not. However, the authors noted, whether this was a causal or associational finding cannot be determined from our data. A 2014 meta-analysis found that coffee consumption, 4 cups per day, was inversely associated with all-cause mortality, a 16% lower risk, as well as cardiovascular disease mortality, specifically, a 21% lower risk from drinking 3 cups per day, but not with cancer mortality. Additional meta-analyses corroborated these findings, showing that higher coffee consumption, 2 to 4 cups per day, was associated with a reduced risk of death by all disease causes. An association of coffee drinking with reduced risk for death from various sources was confirmed by a widely cited prospective cohort study of 10 European countries in 2017. Cardiovascular disease. Moderate coffee consumption is not a risk factor for coronary heart disease. A 2012 meta-analysis concluded that people who drank moderate amounts of coffee had a lower rate of heart failure, with the biggest effect found for those who drank more than 4 cups a day. A 2014 meta-analysis concluded that cardiovascular disease, such as coronary artery disease and stroke, is less likely with 3 to 5 cups of non-decaffeinated coffee per day, but more likely with over 5 cups per day. A 2016 meta-analysis showed that coffee consumption was associated with a reduced risk of death in patients who have had a myocardial infarction. Drinking 4 or more cups of coffee per day does not affect the risk of hypertension compared to drinking little or no coffee. However, drinking 1 to 3 cups per day may be at a slightly increased risk. Mental health. The UK NHS advises that avoiding coffee may reduce anxiety. Caffeine, the major active ingredient in coffee, is associated with anxiety. At high doses, typically greater than 300 milligrams, caffeine can both cause and worsen anxiety. 167. For some people, discontinuing caffeine use can significantly reduce anxiety. Caffeine-induced anxiety disorder is a subclass of substance or medication-induced anxiety disorder. Populations that may be most impacted by caffeine consumption are adolescents and those already suffering anxiety disorders. Preliminary research indicated the possibility of a beneficial relationship between coffee intake and reduced depression. Long-term preliminary research, including assessment of symptoms for dementia and cognitive impairment, was inconclusive for coffee having an effect in the elderly, mainly due to the poor quality of the studies. Parkinson's disease. Meta-analyses have consistently found that long-term coffee consumption is associated with a lower risk of Parkinson's disease. Type 2 diabetes. In a systematic review and meta-analysis of 28 prospective observational studies, representing over 1 million participants, every additional cup of caffeinated and decaffeinated coffee consumed in a day was associated, respectively, with a 9% and 6% lower risk of type 2 diabetes. Cancer. The effects of coffee consumption on cancer risk generally indicate that it is safe, and with no effect or produces a lower risk of cancer. A 2011 review found that regular coffee consumption of up to 6 cups per day reduced the risk of several types of cancer.